Some facts about the Senate's version of Trumpcare leaked, and apparently this bill is even worse than the House version. That even shocks me, because usually the way it works is, since, the House of Representatives is majority Republican, but the Senate's also majority Republican, the House will come out with the most extreme version of legislation, furthest right wing, and then it has to get watered down a little bit in the Senate. Here, it appears to be the opposite. They took an already draconian piece of legislation and they said, how can we make this more draconian? So this is crazy. Let me give you the specifics. Which ACA, Affordable Care Act, regulations would be covered in the state waivers? So what that means is they're going to allow states to opt out of even more provisions now of Obamacare. Let me run through them. Essential health benefits, or the list of 10 services insurers must cover. That includes pre-existing conditions, by the way. States can opt out of that. That was in the House version. But now they added the rest of these. The medical loss ratio, or the regulations of how much premium income insurers must spend on patient claims. All right, let me actually pause there to explain that. Under Obamacare, they made it so that insurance companies, private insurance companies, have to spend, I think it was at least 80% of the money they take in on actual health care. Because before, it was the wild, wild west. There was no regulation of it. And, you would have insurance companies spending like 50% of the money on actual health care and like 50% on overhead costs and fucking bonuses for their executives and all that shit. So this is saying, well, no, we're going to allow the states to opt out of the ratio of how much they have to spend on actual health care. All right, now let me give you the next one. The age rating band, or the requirement that premiums for older people be no more than 3 times the amount of premiums charged to younger people. Again, let me just pause on that and reflect on that. So that means if the insurance companies had their way, the people who need care the most would pay the most because they just want to get as much money from everybody as they possibly can. And when you're sick, they could use that as a reason, like, oh, our hands are tied. We got to charge you this exorbitant amount of money. Now, that flies in the face of how insurance should work, because it should be the case that, well, you pay in all the time, and then when you get sick, you get help, and you don't have to pay any extra. That's the whole point of it, is that you don't go bankrupt when the time comes that you actually need help. But what they're doing here is they're getting rid of the rule that older people can't be charged more than 3 times the amount of premiums charged to younger people. So they're just going to jack up the rate for older people who need care the most. They're going to charge them way above and beyond, probably way above and beyond what they can even afford. So it's making insurance less insurance-y. All right, more. The actuarial value, or the requirement that plans cover a certain percentage of a person's total healthcare costs. They're getting rid of that too. So I don't know what the number is for that. Like, there's apparently a requirement that plans cover X% of your healthcare costs. They're getting rid of that and allowing states to opt out of it. So what's going to happen? Well, what'll happen is all the red states will opt out of all the provisions that are good for the people, and they'll bias it in favor of the insurance companies. So in all the blue states, they'll say, look, for insurance companies in this state, you have to abide by all these rules. In the Republican states, they'll say, no, you could just do whatever you want. You get a waiver. You get to opt out of that. So what happened here is, with the Senate version, they looked at what the House did with pre-existing conditions. The House's compromise on pre-existing conditions between the far-right extremist Republicans and the so-called moderate Republicans was, okay, we're not going to keep the protections for pre-existing conditions, and we're not going to totally get rid of them. What we'll do is we'll let the states decide if they want to opt out of it. They can opt out of it. Apparently in the Senate, they looked at that and they were like, ooh, this opt-out idea is great because we could use this to torpedo a lot of protections for regular people. So we're talking about a bill here that, at least to this point, what we know about it is guts over $800 billion from Medicaid, increases the uninsured rate from 10% to 19%, would be a total of 53 million people uninsured. It's a giant tax cut for the top 1%. I think On average, people in the top 1% get an extra $200,000 a year. I was going to say annually, but that's what a year means. They get an extra $200,000 every year. So what we know about this bill is a disaster, and the Senate just made it worse because they're allowing, to opt out of various protections for the American people. Think about how wildly out of touch this is with what Americans actually want. We've discussed this before. When you polled people about Obamacare, it would usually hover around 50%, depending on when you're asking the question. Sometimes it'd be like 52% that don't like Obamacare. Sometimes it'd be like 52% that do like Obamacare. It'd always be around 50%. But that's actually misleading. Because when you go provision by provision in Obamacare, almost all of them, except the individual mandate, incredibly popular. Overwhelmingly popular. So the Republicans are saying, no, let's take those popular provisions, either axe them, or in this case, this new trick they're doing is allow states to opt out of them. And then they'll hit you with the, I don't know what you're talking about. We're just giving people more choice. We're just giving the states more choice here. Even though it is objective that you will be hurting a lot of people by allowing states to opt out of these basic protections. So this is a disaster. And we'll see what happens here, but if they try to do reconciliation on this and do 51 votes, our healthcare system, which is already a mess, will become an even bigger mess. It's already the joke of the modern world. It'll be an even bigger joke. And the damage done to regular people, it's almost immeasurable, given how the bill that they're working on is just an incoherent mess of right-wing talking points. They're doing a healthcare bill. Not a single Republican can even tell you the problems in the healthcare system that this is addressing. Because it's not. It's making all those problems worse. It's only helping out the health insurance companies. That's what it's doing. It's helping out the health insurance companies, giving them more money, giving them a bigger stranglehold on the market, and screwing over regular people more.